Hello, everyone. Welcome to the Enhancing Lives podcast from Stewart Chiropractic. I'm Dr. Khalid Alibhai, chiropractor and host. And today's episode is a very deeply personal one. My guest is no other than Dr. Shabita Teja, a naturopathic doctor, a pharmacist, and someone I'm proud to call my sister-in-law. But beyond her titles, she's someone who has lived through over 2 decades of chronic pain, surgeries, and healing, not just in theory, but in real life. Her approach isn't just clinical, it's a deeply personal one, having navigated ulcerative colitis, chronic pain, fertility challenges, and even becoming one of BC's first spinal cord stimulator recipients. Dr. Teja brings a very unique perspective and a whole lot of empathy to every patient interaction. In this conversation, we are going to go beyond symptoms and labels and diagnosis. We're going to talk about central sensitization, what it is, how it shows up in the body, and what healing actually looks like when your nervous system is stuck in overdrive. Whether you're dealing with a chronic pain yourself or supporting someone who is, we promise this episode will open up some powerful new ways to think about recovery. Welcome to the show, Dr. Shabita Teja. First question that we're going to go into is if you can take us behind the scenes of your journey. And I know that the journey's not over yet. It's been a painful one and it's been a long one. But if you can just take us behind the scenes of kind of what you've been through so that our listeners get an idea of your experiences.
Yeah, absolutely. Thanks so much for this opportunity. I feel privileged to be on your podcast, and hopefully, some of your listeners can relate to what I've gone through and will come away from this podcast with real life tips in how to heal their nervous system and hopefully start or embark or continue on their own healing journey. But mine started back when I was 19. I'm 41 years old right now. This is, taking place July 23rd, 2025. So at age 19, I woke up one morning and had blood in my stool. And pretty much overnight, but over that December Christmas break period, I lost 20 pounds and was on the couch drinking nothing but Gatorade. I remember not being able to stomach anything except for baby carrots. Like I was healthy as a horse, great childhood, everything prior to that, other than, the cold or flu that you would have. So this was a big change. I didn't know what was going on. Thankfully, in a way, my symptoms were quite severe. And so I got diagnosed quite quickly with ulcerative colitis in 2002. Because my symptoms progressed so quickly, I basically started and failed on a number of treatments. When you're in the conventional medical system, and then I went specialist to specialist and seeing gastroenterologists, you basically are embarking on a treatment hierarchy ladder. So I would start with the 5-ASA, 5 aspirins, didn't work. And then I went to the prednisone and then the IV prednisone and then the immunosuppressants. And none of that was actually helping. And so the top of that treatment ladder then becomes or was the ileostomy. And that's where you have to have your colon surgically removed. And mine was done under emergency surgery. And so I was bumped from 11th on the wait list to number 1 on the wait list overnight because of the threat of toxic megacolon. So when I say that my symptoms progressed from mild to moderate colitis to severe, it's a very literal description of that, and it's exactly what happened. I was lucky in a way because a lot of patients that I see today, they don't have very severe symptoms, which is lucky for them. But when you exist in sort of this autoimmune remission flare situation, your symptoms don't get bad enough to have that surgery, which is a very good thing. But I tend to look at the positive, and so for me, mine was short-lived, severe, and there was no other choice but to have the surgery. So I'm not filled with a lot of regret that maybe your listeners or patients that I talk to on a daily basis think that I might have, because I know that there was no other recourse. Toxic megacolon is where the colon enlarges to a point and is so inflamed that it can basically burst and rupture and can lead to something called sepsis, which is bacteria in the blood. So that is life-threatening, and there is no other choice but to have your colon removed. And so I got my ileostomy bag in 2004, and then I lived pretty normally. I went back to school. I was in pharmacy school at the time at UBC, and 2 years I lived with the ileostomy bag. In 2006, I had what is known as a J pouch procedure. So it was reversed. And it's an ileoanal reservoir procedure, colloquially termed J pouch, because your small intestine, or my small intestine, functions as both a small and large intestine now with the loss of the colon. After the J pouch, I was about 24. I went into that knowing that my doctors had said, the specialist had said, you are going to be 80%. I mean, there's an 80% chance that you will be infertile, not 80% that you will be able to have kids, 20% that you'll be able to have kids. So at 24, I know that was a heavy decision to make. I was with my boyfriend, my husband now, boyfriend at the time. We were not even engaged. So this was a conversation that was quite heavy, but I had to go into it knowing personally that I was taking on that burden, for lack of a better term. And so the J pouch happened. I was relatively quite healthy now, especially compared to the last 3 years, because that, quote unquote, diseased, inflamed portion of my body in the conventional medical system was removed. And so theoretically everything should go on. You're fine now. And to be honest, now if you talk to a conventional doctor and my specialist, like I don't really see a gastroenterologist unless I have something going on with my rectum, because I do have that rectal stump. But I don't see a gastroenterologist because, in theory, I don't have ulcerative colitis because I don't have my colon. So, how can you have colitis or inflammation of the colon without your colon? Just because an organ is removed doesn't mean the energy of the organ is removed. And so, I've come to learn as I've been on my healing journey over the last 2 decades that removing the organ doesn't mean that the pain is removed. So fast forward to 2009, I end up having now upper gastrointestinal symptoms. And so my lower gastrointestinal doctor sent me to an upper GI specialist. And now, as a naturopath, that's just crazy to me because the body is a whole. We don't need to be compartmentalizing the body. But I mean, again, in the medical system, that is what they do, and that's what they do well, right? They're there for a reason. They're there for an acute emergency setting. When you're looking at the body holistically, and now I'm so grateful for what I do on a daily basis, because naturopathic medicine looks at the body, mind, body, spirit as a whole and doesn't cut away at the body. So I was sent to an upper GI specialist. They said it looks like you have gallbladder issues. They did an ultrasound of my gallbladder. Yes, it is inflamed. Yes, there's stones in there. Let's remove that. I had not even started naturopathic medicine at the time, so I wasn't aware of what I'm aware of now. And so the gallbladder was removed. I told my mom before going into that surgery, and she remembers it clearly today. She said, "You told me, Mom, what if I still wake up with that pain?" And to me, now looking back, that was my gut feeling. That was my knowing, my all knowing saying, don't do this. There is a reason for this pain, and it's not the gallbladder. I knew better, but logically, I didn't know better. So the gallbladder was removed, and I woke up with the same pain. And I went on a really challenging, difficult time from 2010 to 2014. And that's when, you remember, I was in and out of hospital, in and out of St. Paul's inpatient program. So I did about 5 different times, 3 week stints each as an inpatient, on IV ketamine, on ketamine comas, on Percocet, on methadone. And that's just the major drugs that I was on. I tried and tested antidepressants for the pain, like tricyclic antidepressants. I tried cannabis, both prescribed and non-prescribed.
Did
Really,
everything you could,
I did
everything.
everything I could. Yeah, but
What was the
nothing.
pain level like on a scale of 1
10,
to 10? So people, it was a 10.
10. 10 out of 10. My body was on fire. I literally could
Mm.
not feel. I could not, when you talk about grounding, I couldn't ground. My body was on that, like that fire alarm was going long after the gallbladder was removed. My body was still in a state of, you are in intense pain, shut down the hatches. This is like, we're in defense mode. I needed to integrate the two. But you know better, hindsight is 2020. And I'm so glad I went on that journey because I wouldn't be sitting in front of you today learning the lessons I did. And I'm not able to impart that, not only empathy, but hopefully medical knowledge and holistic wisdom to my patients to say, listen, learn from what I did. I've done the work now and I have gone through really challenging times, but I have a spinal cord stimulator that has helped. That was 2014. So now it's been about 10 years of the spinal cord stimulator, and I'm still in a place of continual healing, but I'm not in that 10 out of 10 5 alarm fire state anymore.
Was there a moment where you felt like the healing shifted because, you've had that severe pain for so long? Or was it just this gradual improvement? Did something change in your life where you're like, oh, wow, I'm starting to notice a difference now?
So, two things come to mind. In 2014, when I got the spinal cord stimulator, that helped break the pain gate cycle, right? There's a top down. Now we know that pain is not just a bottom up approach. It's not just going from I'm hitting that hot stove and I withdraw my hand because my brain has that instant feedback loop. We now know that there's a top down approach where the brain also influences the pain and vice versa. Just like we know the gut brain connection is a bidirectional communication, the vagus nerve is that super highway. Like we know more now about the nervous system. Central sensitization wasn't even a diagnosis back in 2011. It was around 2014, 15, after I had the spinal cord stimulator, that they were throwing that term around. And these are chronic pain specialists that have been in the field for decades themselves. So this is a relatively new diagnosis. It used to be called, for your listeners, complex regional pain syndrome or reflex sympathetic dystrophy.
Mm.
So CRPS or RSD, your listeners might know, oh yeah, I remember that, or I've heard of that. That is sort of changed now to central sensitization as a catch-all of this. Your nervous system is on fire, your body is in pain long after there's actual physical pain, but you still feel pain. So, quite literally, I had an interruption of the pain signal with that spinal cord stimulator, and it was non-drug. And for me, that was important because I'd been on so many medications and I wanted off. I wanted off of the ride. I didn't want to take anything else that was going to make me fuzzy or not feel into my body anymore. So that was one big change. And that allowed me to come off of the ketamine comas, the IV ketamine 3 week stints in the hospital, the methadone, the Percocet, all of those subsequent drugs, even the cannabis, like all of that stopped after spinal cord stimulator. So that was very big. And I felt the fog was starting to clear. The second period of change that I feel is in the last year, I would say. And I feel like that has happened because of the work that I continue to do with, everybody sort of recommends this person and this person to you and try this and try that. And I would try a lot of things. And so I always tell patients now that I have a toolbox in like, this is my toolbox. Your toolbox is different. Mine is continually changing. So what I used in my toolbox like a decade ago is different than what I used a year ago. That's different than I use today. So today, what I have is a lot of mind body work, a lot of grounding, a lot of breath work, a lot of nervous system support, a lot of boundary work. So I would say that has been a big shift in the last year, not even year, like 8 months, really. And Jody, I mean, that's sort of the
Mm.
counselor. I mean, she's not a doctor. And that was the first thing, like, my parents kind of asked, like, what are her credentials? Well, she's healed herself. And for me, I went in with an open mind, and my lovely sister, your wife, Dr. Shahana Alibai, I was signing up for her talk, and Jody Galeen was a host. And so I, was registering for Shahana's talk and came across Jody's story. And I was like, that resonates with me. did a discovery call, a complimentary discovery call with her, and it really resonated what she was saying about pain and that energy stagnation turning into pain. And do you want to learn how to change pain? And I was like, yes, I'm all ears. So my ears are always open to what is the new thing that I can do and try. And that's just me. Sometimes it's too much, and sometimes I've had to shut down, put my boundaries and put my walls up and say no more. I don't want any advice. I don't want to hear any new treatments. But I was in an opposite state of being at the time, and I was welcoming that advice, and that has really helped. I would say those two big shifts happened.
Yeah, I mean, you think about the statistic that 2 out of 5 Canadians, North Americans, have chronic pain, some sort of chronic pain in their body, meaning that it's been going on for more than 3 months. And a lot of people, I think, they've lost hope, or they've tried things in the medical system that haven't worked for them, or somebody's told them the wrong phrase, which is it's in your head.
Mm-hmm.
Central side sensitization. People say, okay, well, it's just in your head. Obviously, not everybody will need a spinal cord stimulator because you're only one of a couple hundred. And a lot of people have tried different medications and drugs and painkillers that may help kind of ease the pain. Maybe they've heard about breath work and being present, but sometimes when the pain is so high or so intense, how do you bring yourself to that place where, like, okay, I'm going to try this, and
Mm-hmm.
maybe it doesn't work right now, but I have to stick with it consistently? Was it
Mm-hmm.
having somebody that you're accountable to? Was it knowing that you weren't alone? Or you just had that open mind, I'm going to try something new?
I'm an individual. What I love about naturopathic medicine is it's individualized medicine, right? And so not one size is going to fit all. I could feel that lowering my nervous system and turning down the temperature really helped. And so for me, I actually did reverse. I didn't feel into my body first. I lowered the temperature, meaning trying to do and adapt ways of life that would help to bring down the elevated temperature of the nervous system, meaning like the nervous system is highly stimulated. Okay, I understand I have central sensitization. What can I do to bring it down more into rest and digest, which is a parasympathetic nervous system, rather than fight or flight? That is something that a decade ago I was grappling with.
What are some things that people can do? They're listening to this right now, whether they're in
Yeah.
their car, they're at home. Is there a certain type of breath work? Is there a certain reframe? Like, what do you use exactly? If you can give us an example.
I tell every one of my patients that this is a low hanging fruit. Every one of you listening right now can do this, and it's a deep belly breath. I love it
Mm.
so much because it literally triggers physically the vagus nerve. That is that super highway I was talking about. It is cranial nerve 10, the largest nerve that activates our parasympathetic nervous system to get into rest and digest. When we're being chased by a lion, evolutionary, back in the day, we are under fight or flight. We're under that sympathetic nervous system. Now we know you're either fight, flight, or frozen. And so you see these people that quite literally can't make a decision. For healing, we want to be in rest and digest and not in fight or flight, because fight or flight is meant for safety. Our blood flow shunts to our limbs, our pupils dilate. We are trying to escape that so-called threat. So the dry hair, skin, nails, all of that, if you're noticing that, that means your body is in protective mode, because it's not shunting to the things that allow us to feel and look a certain way and feel like we're healing and feel loved. Perhaps this deep belly breath would help, because it triggers when you do a diaphragmatic breath and you actually are expanding your belly, not just shallow breathing. 90% of our population, I dare to say, I don't have any studies behind this, but if I look this up, I'm sure I could find some, where our population is dehydrated and we are shallow breathers. We do not expand our belly and we do not trigger that vagus nerve. So just if you're listening in the car right now, if you're sitting at work, ground, put your feet, feel your toes under your, feel your toes, sit, feel that, you're back in the chair, expand your belly and exhale, and make that exhale longer than your inhale. And what that does chemically, And blood pressure wise, your vagus nerve gets triggered to the oxygen carbon dioxide concentrations in the alveoli in your lungs. And that blood pressure changes or fluctuations in the sinoatrial node in your heart. So your vagus nerve controls so many functions, but those are just two. When your exhale is 2 seconds longer than your inhale, you're triggering that vagus nerve as well. And so what I've learned too with, I was just listening to a podcast the other day with Huberman Lab. He mentioned as well that when you inhale, take a deep inhale through your nose, take another quick inhale to expand the alveoli, and then exhale fully, mouth breathing, fully out, empty your lungs. You've triggered the vagus nerve. And you will feel that calm. And that's just after one. Try doing five before you eat, while you're brushing your teeth, while you're sitting in traffic, before your next meeting. And you will start to see that shift away from sympathetic dominance to rest and digest. And that was a big help to me. And I try to impart that wisdom to every patient because, dare I say, 100% of patients can benefit from that, no matter what their condition.
I love how you describe the why behind it. Instead of saying just do breath work, you kind of gave us the reasoning behind it. And I think that's what people need to get into action instead of what to do. It's also why to do it. We know that you're not only a naturopath, but before that, you were a pharmacist, and you are only, from the research that I've done, less than 100 naturopaths also have a pharmacy degree in all of Canada. And I wanted to give the listeners an idea of, okay, you've given us some tools on things that we can do on our own, which I love. What are some things that when someone comes to see you, obviously, like you mentioned, every patient's unique, but what are some tools that you use? And I know that naturopaths practice with different techniques, just like as chiropractors, we have different techniques. But what are some tools that you use so that if a patient is, one of the listeners is coming to see you, or maybe they want to go find a naturopath, what are some things that they would expect or experience when they come see you?
That's such a good point that individualized medicine, but it's not one size fits all. So that's great because on the flip side, you don't know what you're going to get. So with each naturopath, you can get a little bit of a different treatment. You maybe walk away with a big bag full of supplements with one or get IVs with another. First off is do your research. Second thing is most, if not all naturopaths offer a free complimentary 10 to 15 minute, what we call meet and greet call or in-person visit. So that is as much you interviewing us as we are interviewing you. And what I mean by that is we want to make sure that just like a psychologist or counselor, or therapist, you want to resonate, right? Just like a chiropractor, you want to resonate with that person because you do want to go on a healing journey with them. You do want to feel supported. And so take advantage of that. And so that is, if I can give a little pearl there for your listeners, is take advantage of that free 10 to 15 minute meet and greet. And if it's not offered on a particular naturopath's website, like on mine, when you book now, it is offered right at the, start of my appointment types. But if it's not, then just ask for it because it should be. So that's number one. When my patients come to see me, I deal with a lot of gastrointestinal. I also deal with a lot of patients wanting to come off of medication. Again, understandable because of my pharmacy background. So I have a confidence and a comfort with tapering patients off of drugs that no longer serves them or suits them while introducing tools and lifestyle, diet, different measures, including supplementation with herbs and different vitamin supports that allow longevity, allow vitality without needing the medications and side effects. Everybody needs, at certain times you need medication, right? I have been on, and I listed a laundry list for you at the beginning of the episode. I myself have been on a number of medications. I know that they're needed at certain times. What I do in my hour-long initial visit is go through everything from your most bothersome symptom that brings you into my office that day to your family history, social history, your stress level, sleep, temperature, toxicity. Like, what are your toxins? Do you live in an old house? Do you live in a new house? Do you have mercury fillings? Do you have seasonal allergies? What exercise do you do? What's your energy level? Give me an idea of what you're eating on a day-to-day basis. Like, we go through everything. Food, menstrual cycle, sleep, that's just to name a few. And then we do a head to toe review of systems. And so if anything comes up on there, I'm going from your most bothersome symptom to your toes and everywhere in between to make sure that in that hour, in about that 45 minutes, you're doing as the patient a lot of the talking. And I want to round out your case to make sure that I understand fully what seems to be the root cause of your problems. And it can be usually one, two, sometimes three root causes, but they're usually one to two root causes that cause downstream symptoms for a lot of patients. And my job, or what I feel my job is as a naturopath, is to help heal that root cause and improve downstream all the symptoms instead of doing a band-aid approach for that headache or for the rash or for the bloating. I figure out what that root cause is with you as a patient, and then we work least to most invasive in our therapeutic, naturopathic therapeutic order to help heal that root cause. And, if you're not feeling better on a week to week basis, then I'm not doing my job. And so I always tell patients that give me feedback, let me know, let's follow up in 2 weeks, let's follow up in a month. And then if I'm doing a good job, then I shouldn't see you for 3 to 6 months, right? Then we're checking in, but I help you navigate that healing journey in the crisis like I was, right? In 2011 to
Mm.
2014, I help you sort of, if you've gone and seen tons of specialists like I had, and everything was like, no, you're a complex case. We don't know what else to do. You're a complex case, complex case. Yes, I was a complex case, but that doesn't mean that I didn't have a
Yeah.
right to be healed, right? And
Yeah.
that's where I find the beauty in naturopathic medicine. As a pharmacist, I understand the medications. I know difficult, quote unquote, difficult cases. And so that's
Mhm.
what patients will get with me.
I mean, certainly, maybe there's a fear. Some people, they go see a practitioner that, let's say, they're going to end up on a bunch of medication, or they're going to end up on a bunch of supplements, or they're going to have too many treatments that they don't need. And I love how you talked about getting to the root of it. And you've had two miracle babies that we didn't talk about, my nephews. And
Mhm.
they're how old? 4 and coming up to 2.
Yeah.
And there's another topic that you could dive deep into. And often it's the experiences that we have personally that allow us to, we're most qualified to treat the person we once were based on our experiences and then your professional knowledge. So I'm just amazed at the breadth of experience and knowledge that you can bring to helping patients, and how you're still able to have compassion for them. And maybe we can kind of just briefly talk about this, is that you've had to show up as a wife. I know you've got an amazing supportive husband,
Mhm.
my brother-in-law, and
Mhm.
not everybody has that kind of support. But how were you still able to show up with the level of empathy, compassion for your kids, your spouse, your parents, all while you're still in pain? Because everybody, like you mentioned, reacts a little bit differently. Some people freeze, some people, they get angry more often, they get more irritable. How
Mhm.
did you find that strength to still have some presence? Because I'm always amazed at how you're able to dig deep and
Mhm.
still try and participate in family gatherings, even though you
Mhm.
were probably at a 10 out of 10 pain. What are some tips you can give people who are struggling right now with the pain, but still have to show up?
We're all learning, we're all growing continuously. And if we're not doing that, then there's something wrong, right? So, what I know now, which maybe I wish I knew 10 years ago, and there's a reason for everything, you have to meet the patient where they're at. So, that is
Mm,
number one, I think, where you have to know your body best. And nobody knows your body better than you do. And so for me, when I'm sitting in front of a patient, I take what they're saying as gospel, and I'm listening for the clues that their gut is telling me in a way, if that makes any sense. Like their gut feeling, the reason they're even sitting in front of me, there's a reason for that, right? I don't believe in coincidences. So if I can relay some knowledge or past experience, in my humble opinion, to your listeners, is to trust your gut. Trust that gut feeling that you have, because the more that we avoid that and adapt, then the body will scream to us instead of lightly tap to us. So for me, it was the pain level was dialing up and up and up because I wasn't listening. I kept trying
Mm,
to shut down the pain with painkiller upon painkiller. And that's what I felt. That's what I was telling my mom before going into the gallbladder surgery, that, Mom, what if I wake up with that same pain? I knew, but I didn't trust my own wisdom. And maybe it's life experience, it's whatever, biological age, chronological age, whatever you want to call it. But now I see that no, I can trust myself. I do have wisdom. So trust yourself, trust your gut. Don't adapt at the expense of your authenticity, and sit with that for a little bit. What does being authentic to you really mean? Because that's why I can show up at family gatherings. That's why I can dig deep and have empathy. It's because there is this term called being present. And so when I'm truly present and I've looked after myself, then I have enough in my cup to give to others. And I just told my husband, Aleem, the other day, I was like, I'm going to need about 24 hours where nobody reaches me. And I've never said that before. And I said that just recently because I know if I don't take care of myself, I'm no good as a mom. I'm no good as a wife. I'm no good as a sister, a daughter, a sister-in-law. Like I don't have anything to give, and certainly not as a naturopathic doctor. On purpose, between patients, will just sort of like energetically also deep belly breathe myself, because I
mm,
have to move away from what that patient just told me and all the life and wisdom that they've imparted to me and all the hardship and what they've gone through, and not take that in, not take that on, not take that into my next appointment. So I myself am on a continual journey of learning what it means to be present, to be grounded, and to trust my gut. And I think that's how I'm able to, and I'm still, learning always, but that's how I'm able to, it looks like giving, but it's because I've said no to 10 other things and I'm showing up for that one thing. And also knowing your why. Why are you doing what you're doing? That was also very
mm,
important to me. And it continually is. Like getting through naturopathic medicine, I took 9 years to complete a 4-year program. For pharmacy, I took 5 years to complete a 4-year program. I was getting worse as I progressed. But actually, I see that now as such great learning, because I now know that I needed to trust my gut and know what my why was. I could see myself treating patients. I could see myself
mhm,
walking across the graduation stage. And I knew that, okay, Shabita, you're in bed right now. You can't get up. You're waiting to take your next Percocet because you can't go over the limit, because you've taken, 8 today and you're only allowed 10 for today. Like that was what was in my head on a day to day, month to month, year to year basis. And months become years, and then years become decades. So what is your why? What is the reason for you to get up? Because all you need to
mm,
do is get up one more time than you've fallen. And that quote for me is gospel to me, where even today, if I'm having a bad day, or if I'm having days where, yeah, the pain is higher and I've tried all my tools and nothing is working, well, Shabita, take that day then. Say no to all the commitments that you have. And that's
mm,
okay. The power of no is really important. Boundaries are really important. So, protect yourself, because we only get one body, right? We only get one
mm.
of this. So protect it. And that is how I'm able to then, it looks like showing up, but it's because I'm present and I've said no to a lot of other things.
Wow, I love that. I admire you so much, and I hope you know this because of how you show up for other people, and that can be hard. Sometimes we've given more than we have in our tank, but you've maintained a very powerful why throughout many events in your life, even from your pregnancies, have been the most complex than any patient I've ever heard. your why was whatever that was in that moment for your unborn child, right? That mantra you had in your head, that feeling. And now our whys can shift depending on the stage of our lives. But knowing that, I think, is so important because maybe it gives us that extra juice. Because I know how many times you've been in so much pain, but you still would check in with other people to see how they're doing or try and help them with their health condition, even though you were suffering so much. I think we can draw a lot of strength from that in knowing that there is a reason why we're here and that it's okay that to say no, like you mentioned. I think that takes a lot of courage to do that and a lot of vulnerability because sometimes often it means telling somebody else no. And often I find that when you do that, people can maybe respect you more or will honor that decision because you're saying, I need to take care of myself so that I can help somebody else. This has been amazing. This is obviously the first time that we've been able to do a podcast episode like this together. I think it's been in the making over the last 20 years, and there's a lot of things that we can talk about. Obviously, I think you're an amazing person, practitioner, sister, spouse, mother, and I hope that you continue to share with us your journey because you have a lot to teach people. I keep telling you that you have to write a book. And so, as much as you can, share your story. I want patients to see you. I think it's so important. It would almost be a disservice for them not to be able to see you and to hear the wisdom that you could impart to them because I know that you come from such a good place. Where can people find you? I know that you're also a clinician at the naturopathic school, but you're also working out of a clinic right now in New West. Where can people get a hold of you?
If you go to my website, tejawellness.com, you will be able to book now, and I'm accepting new patients. So I work at Polo Health now in New Westminster, as you mentioned. So I'm 2 days a week there. I'm 2 days a week at the Boucher Naturopathic Clinic. That's where I graduated naturopathic medicine. And so I feel really great about being a clinic supervisor there 2 days a week. And I get to teach and impart that. And I learned just as much from the students. I know it's kind of cliche, but I really did always want to come back because I spent so long there. I spent 9 years there in and out of school. Those are the two places where you can see me clinically. I am, starting to engage on social media more. Like we said, the power of saying no. That was one area where I said, I can't do that right now when I was having my kids, but now I'm starting to engage more on social media. So I'm on Facebook, Instagram, dr.shabitateja.nd, dr.shabitateja.nd, but you can find all of that on my website, tejawellness.com.
TEJA wellness.com. I know I've done virtual calls with different practitioners. Can people do a virtual call with you if they're in another city?
Absolutely. Yes, absolutely. COVID was really great about teaching all of us, the power of Zoom. Telemedicine is a real thing. Phone call, video consults can be done, and I do that happily, and I do that for a number of patients. So yeah, absolutely. Wherever you are in BC, you can get a hold of me.
Yeah, the nice thing that, we've learned over time is that, 90% of the time you can get the diagnosis from the history somebody's telling you, but also if they need a
Exactly.
test, you can now send them the test to do at home and then get the feedback so you can have that interaction virtually and still get the results you're looking for.
Absolutely. Yeah, for sure. And get a lot of shifts and, powerful forward movement in your own health and wellness journey for sure.
Shavita, this has been amazing. Thank you so much. And hopefully you get some time to decompress for yourself after this.
I will. Thank you so much for having me on. This was so much fun. Thank you for, what you do as well. So I learn a lot from you, even though you're younger than me, but I do learn a lot from you. And just, yeah, thank you so much. And hopefully your listeners enjoyed this episode. Thanks again, Colin.